Hi everyone, my name's Sophie. 16 days ago I had trans PRK eye laser surgery at a clinic here in New South Wales, Australia. So basically I'm hoping that this video will be a useful resource to maybe anyone considering having PRK eye laser surgery or just wanting to know a little bit more about the process or anything like that. So I'll describe how the surgery worked and what happened to me, and then I'll also describe my recovery process. So hopefully it'll be of use to you. First of all, I'll tell you a little bit about myself. I'm 21 years old now. When I was about 8, I started wearing glasses. I didn't really like glasses, so I decided to wear contact lenses when I was about 9 or 10 years old. So they were great at first for me. I really enjoyed wearing them, didn't have any troubles or anything. But then as I got a little bit older and started university when I was 18 years old, I noticed that they tended to dry out after using laptops and doing, readings and that kind of thing. So they weren't particularly, useful to me anymore because I didn't get the wear out of them. So I decided to find a solution to my problem. So 7 days before my surgery, I had a consultation with a laser clinic here in New South Wales, Australia. For the 2 weeks prior to that initial consultation, I wasn't allowed to wear my glasses at all. Sorry, I wasn't allowed to wear my contact lenses at all. I just had to wear my glasses, which I didn't like very much because I don't like wearing glasses. Then at the initial consultation at the laser clinic, a number of tests were run on my eyes, and because my vision had not deteriorated for approximately 3 years, I was deemed to be a suitable candidate for trans PRK eye laser surgery. So I decided to book in to have the procedure done that next week, so a week later. On the day of the surgery, I arrived at the laser clinic at about 1 p.m. On my arrival, I was given a 5 milligram, I think it was, Valium, which basically just calmed my nerves because I was quite nervous on the day of the procedure. Then, after the Valium took effect, at about 2:15, one of the nurses called me back into one of the pre-operative rooms, I guess you'd call it, where I put a shower cap sort of over my hair just to make sure there was no hair on my face. And I also put shower caps sort of on my shoes. And one of the nurses cleaned down my face with a liquid, and anesthetic drops were put in my eyes, as well as a number of other drops, which I can't remember what they were. So basically after all the drops were put in my eyes were completely numb, could not feel a thing, couldn't even feel myself blink. So then I was asked to wait in a different room for about 10 minutes to make sure all of the drops had done their magic. And then after those 10 minutes I was called into the operating theatre by a nurse, and that's where the doctor was and all of the other nurses, who asked me to lie down on the operating table. They asked if I could sort of center my head within this groove that was inbuilt into the operating table, just to stabilize my head and make sure it didn't move during the procedure. So I did that, and some more numbing anesthetic drops were put in my eyes, completely numb of course. And then one of the nurses put like a shield over my left eye, and then after the shield had been put on, I was sort of lowered down and back underneath the laser machine, and that is where the doctor then put this spring in my right eye that was being operated on. He put this spring in to prevent me from blinking, but I couldn't feel that go on or anything because my eyes were completely numb. He then asked if I could stare into the blinking green light and just stay very still. Then he sort of aligned my eye directly beneath the laser and turned the machine on. And I couldn't feel a thing when the machine was turned on, to be honest. I could not feel anything. So it was very quick. It was about 30 seconds for my right eye. Then the machine, after those 30 seconds, was turned off. And the doctor then put some more drops in my eye, and he put a protective contact lens over that right eye. Then I was basically brought out from underneath the laser machine, and the procedure was repeated then on my left eye. So 30 seconds under the laser, then contact lens over the top, and then after that was all complete, they put some protective goggles on my eyes, which looked very attractive. Anyway, then what happened then? Yeah, then I think I was sent home. That was about it. Completely painless. Felt a bit silly because I was really nervous beforehand going in, and afterwards I was just all smiles, you know. But my vision on after the procedure had taken place, to be honest, it really wasn't improved at all. Like my vision sort of kept going in and out of focus and that kind of thing. So, but that's completely normal. That was to be expected. Then on arriving home, I kept a diary, by the way. On arriving home, I began to experience some mild discomfort, which could be described as the feeling of gritty eyes. So I guess that's when my my anaesthetic drops were starting to wear off. It says in my diary here that at about 8:30 p.m. my discomfort increased and my eyes started watering. So I took 2 Panadol and then an hour later a sleeping tablet to help me go to sleep. That night I had to keep those attractive goggles on my eyes just so I wouldn't rub out the protective contact lenses that were put on my eye. But when I'd taken the sleeping tablet, you know, it wasn't hard to sleep, so they weren't, you know, a distraction. Then that was day 1. So day 2, I've got here written in my diary that I awoke to the feeling of gritty eyes, and which wasn't particularly pleasant. And then, you know, my eyes were watering a bit as well. I found that I could not keep my eyes open for long periods of time. So basically, I was in a really dark room, sunglasses on, basically just tried to sleep, just keep my eyes shut as much as I could, just to prevent, you know, some of the running and that kind of thing. It says here, in terms of the clarity of my vision, it was a little bit better than the day before, but it was still shifting in and out of focus, so not a big improvement yet. On that second day, I had my first post-operative appointment at the laser clinic. My doctor just did a few tests and asked how I was going and that kind of thing. He asked if I could read anything off the eye chart, which they had in the doctor's surgery, and I was so surprised because although my vision didn't seem to be that good, like when just looking around in general, when I looked at the vision chart, the chart thing, I could read down to the 3rd bottom line, which I've just found amazing because before my surgery I couldn't read the first letter without my glasses or contacts, so that was really exciting. My doctor then sent me home with 3 different types of eye drops, which I applied for 4 times a day, so 3 lots of eye drops 4 times a day. So I'd go like 8 a.m, 12 noon, 4 o'clock, 8 o'clock, which is the easiest thing to remember in my opinion. And then I've got written here, on day 2, by the afternoon my eyes had become quite painful and watery, so I took some Panadol or Digesic every 4 hours, which helped with the pain. And it says here, later in the evening I began to feel queasy. I'm assuming that's because of the amount of eye drops that I was putting in, because they'd roll down your throat and go into your stomach. So I took, when I started to feel queasy, I took one of the nausea tablets that the laser clinic had given me, which completely cleared that up. It was really good. And then I took another sleeping tablet that night, which was handy. Then I've got written here on day 3, so the next day I woke from an excellent sleep. And it's nice, it says the first thing I noticed was how much clearer my vision was than the day before. So that's exciting. And I also found that I could keep my eyes open for longer periods of time, and that my eyes were not shifting in and out of focus as much. So, on day 3, starting to notice a real difference. I think that's, what else? Says also on day 3, I did not need as many painkillers, and in fact I only took 4, I think it was 4 Panadol all day, and that was it. But still, that day I found that my mobile phone screen was definitely too bright and sort of out of the question, and laptops and TV were the same, just too bright and not very pleasant to look at, so I just completely avoided those things. And just continuing to wearing sunglasses inside. So day 4, it says, today I'm still wearing sunglasses inside, but I feel much improved. This is the first day that I've been able to look at my phone and check my laptop. Tonight I'm going to the laser clinic to have the protective contact lenses removed from my eyes. So yeah, that night I went back into the laser clinic and the doctor removed those protective contact lenses. I found that it was sort of disappointing after that point because my eyes went backwards a little bit, which he said is very common after you have the protective lenses removed, that your vision will go backwards. And yeah, they just felt a bit scratchy and watery and that kind of thing. So I think I took a bit of pain relief to sort of fix that up pretty quick smart. Then the next day it says, my eyes felt gritty when I first woke up, but after an hour or two and an application of the drops, my eyes cleared up. My vision does still feel a little bit worse after getting the protective contacts removed, but yeah, the doctor has said that my vision by tomorrow will improve. But yeah, on a more positive note, it says here that by the end of the day I was watching TV and felt pretty good. Still trying to keep a little bit of distance from technology though. And then the next day, day 6, just says eyes felt a little dry when I woke up, but the drops fixed that. Vision is probably the same as it was last night, sometimes clear and other times still things go out of focus a little bit. And then I've actually stopped writing things in my diary from that point. Basically now my vision is really, really good. The only thing that is really noting is when I look at a book, or even sometimes like the computer screen, when I blink, it'll go, the text on the screen or in the book, it'll go a little bit blurry, but then when I don't blink for a little while, it'll go clear again. So apparently that's really common. I asked my doctor about that when I saw him, I think it was 2 days ago. That was 2 days ago was my 2-week post-operative appointment, and that went really well. He said that the blinking blurriness is very common, and within a few weeks that'll completely clear up, so that's really good. And I read the eye chart again on 2 days ago, and I have 20/20 vision pretty much, so I could read down to the second bottom line, and that was great. So hopefully I've got another appointment in I think it's in about 6 weeks time, so hopefully by that point I'll be on the bottom row. So but in terms of drops and that kind of thing, I think I had the 3 different types of drops to start with, but then you gradually taper those back, and now I'm just on 1 sort of drop a day, which is Flucon, and I still have to take that 4 times a day, just 1 drop in each eye. But as of today is Thursday, but as of Tuesday I'll be able to taper that back to 3 drops of Flucon per day, and then the following Tuesday it'll be 2 drops per day, then the following week it'll be just 1 drop per day, and then hopefully I'll be completely weaned off. So I hope this video has been of some use to you, whether you're thinking of having PRK eye laser surgery, or, if you're eligible to have LASIK surgery, hopefully it's opened your eyes a little bit to laser and the types of technology that are out there and what's available to you. So good luck with everything. And a good piece of advice that my doctor gave me is not to expect perfection. He said, the people that expect absolute perfection are the ones that, become disappointed or whatnot. But, the success rates with eye laser surgery are just amazing. So good luck. Hope it's been useful, and I'll see you later.